Good morning! I am Captain Lady Jean Buna from Brokenshire College and I will be your student nurse for today. What should I call you?
You can call me,
Oh, great name, Enel. How are you?
I'm okay.
Oh, yeah. And I want you to know, Enel, that I am going to check your shoulder, arm, hand, finger, and chest area. Are you alright with that?
Okay.
Okay. And then Inel, as you can see here, it is a private room. It is a private room for the both of us. So it's for your privacy purpose. So before I'm gonna start, I will hygiene my hands, and we will proceed to our checking. Using the alcohol, we will hand sanitize our hands to prevent the cross-contamination to our patient. And we need to use the gloves before we're gonna start our checking. Now that we already done hand hygiene and hand gloving, we will start our checking, sir, which is the upper extremities overall for your skin coloration, if you have any lesions, texture of your skin, and many more. So can I hold your hand? As I can see, there is no abnormal findings. His skin coloration is normal. There is no sign of lesions, and the texture is smooth. There is no tenderness and swelling. Next step that we are going to do is the test function of CN11 spinal by the shoulder. So can you shrug your shoulders, sir? Okay, very good. So, he has a normal findings, which is there's a symmetric and a strong construction of trapezius muscles. There is another procedures of CN11 spinal, which is the spinal accessories. We need to turn his head against the resistance. So, he has a normal findings. There's a strong construction of sternocleidomastoid muscles on the side opposite turn face. Next step is to palpitate his shoulder and arm for the tenderness, swelling, and temperature. So sir, can I hold your shoulder and arm? So he has a normal finding. He does not have any redness, swelling, tenderness, and his temperature is okay. The next procedure is to check his epitroclear. So can I hold your arm, sir? Another one. So he has a normal findings. His lymph nodes is on the normal size. After we finish checking his epitroclear lymphs, which is normal, so we proceed to the test room of the elbow. So sir, You need to follow my instruction. Can you stand up and stand straight? Follow my movement, sir. Another one. Okay, so the patient has a normal finding of the elbow. He has a 180 degree of flexation, 180 degree of extension, 90 degree of suppression, and 90 degree of pronation. So the next step is to palpitate his brachial, ulnar, and radial pulse. So can I hold your arm again, sir, to get your brachial, the ulnar, and radial pulse? This is the brachial pulse. This is the radial pulse. And the ulnar. And the other one. So the patient's brachial, ulnar, and radial pulse is beating normally. So after the palpitating his pulse, we need to test the ram of his wrist. So sir, follow the movement of my wrist. Okay. Okay. Okay, very good. So the patient has a normal findings. He has a normal findings with 90 degree hyperextension and 90 degree of flexion. So the next step is the test ram of the finger. So sir, follow the movement of my finger. Okay, very good. So the patient has a normal findings. He has a 30 degree hyperextension and 90 degree of flexation. So the next test is the test of the bicep, tricep, and the brachioradialis using the reflex hammer. So I don't have a reflex hammer, so I have an imaginary reflex hammer. This is a pencil pen. So now I will demonstrate. We need to okay, another one. So he has a normal finding with his bicep, tricep, and then his brachioradialis, his bicep reflex, elbow flex, and construction of the bicep, and filled, cansin and filled. In the tricep, the elbow extend and the tricep construct. And in the brachioradialis, the forearm flex and supinate. So after the test of the bicep, tricep, and the brachioradialis, we will test the alternating movement of the hand. So, sir, follow again. So, up, down, up, down. Another one, up, down, up, down. Very good. So it is a normal finding. The patient can rapidly turn up and down his hand. So the last step before we begin today chest area is the test sensation. So sir, can you close your eyes? Tell me if it is soft or sharp.
Soft. 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 Sharp.
Okay, very good. The patient can identify which is the soft and the sharp. So sir, part of the test sensation is the test sensitivity. So tell me if where is the object located, if it is down or up. Yeah, you get
Okay.
it, sir? Okay. Just close your eyes, sir. Okay.
Down. Up. Down. Up.
The other one.
Up. Down. Up. Down.
Okay, very good. So the client does not have any abnormalities. It's because he can identify the location of the object. So the next test is the test of stereognosis. So, sir, just tell me what object I put on your hand.
Yes.
Okay.
Cotton band.
Okay.
Nail cutter.
Very good. Other one.
Pentel pen.
Very good. Patient can fully identify which object I put to his hand, so he has a normal findings. So the next step that I'm going to do for the test sensation is the test of rhapesthesia. So sir, tell me what number I write on your palm. So close your eyes again, sir. Then tell me what number is this.
7.
Very good.
3.
Okay, another one.
18.
Very good.
23.
Okay, very good. So, the patient can identify what number I write on her palm. So, he has the normal findings. The last step of the test sensation is the test of 2 points discrimination. So, sir, close your eyes again and give me your hand. So, tell me how many points I made to the part of your hand. So, first is on your fingertip.
1. 2.
Okay, in the forearm.
2. 1.
Okay. On your dorsal hand.
1. 2.
Okay. So the patient has a normal finding. He can identify all the sensations. So now that we already done checking his arm, shoulder, finger, and hands, so we will start checking his chest area. So before that, we need to ask the patient to continue sitting with a hand on the side, and we need to go at the back of the patient to untie his patient gown to expose his posterior chest. So we will untie his patient gown now. So now that our patient already exposing his posterior chest, we need to inspect the configuration and shape of the muscles and the chest wall using the breathing. So inhale, exhale, inhale, exhale. He has a normal findings. His shoulder is equal and the scapula is same level. Next step is to palpitate for the tenderness, sensation, masses, lesions, crepation, and frications. So we need to palpitate now. It is a normal sign of findings. There is no any signs of lesions, masses, or tenderness. So next step is to evaluate the chest expansion at the level of T9 or T10. So sir, can you bend down a little bit? Bend down, sir. Bend down. Okay. Hold your breath, sir. Inhale. Exhale. Inhale. Exhale. The patient has a normal findings. His chest expansion is symmetric. Next step is to percuss for the tone at the postural and the intercostal space. Determine the diagrammatic excursion. And you need to inspect the breath sounds of the patients using the stethoscope. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. The patient has a normal findings. There is no sign of abnormalities. The breath sounds is normal loud. Next step is the test of the 2 points discrimination at the patient's back. So sir, tell me how many points I point to your back.
1, 2, 2, 1, 1, 2.
Okay, very good. The patient does not have any abnormalities to his sensation. He can identify how many points I made to his back. Next step is to escalate the apex and the left external border of the heart during the exhalation. So, sir, inhale, exhale, inhale, exhale. So, the patient does not have any abnormalities. The last procedure that we need to do is the anterior chest. So, first step, we need to inspect the anterior posture of the chest, the lift of the ribs, the coloration of the chest. Note the quality and pattern of respiration, the rate, hem, and the depth. Observe the intercostal spaces for vagging or retraction using the accessories muscle. Stand straight, sir. I will check the color of your chest and the lift of your ribs, diameter. Okay. Breath. Okay. Breath. Okay. So far, there is no sign of abnormalities, including the chest color. It is a normal. Next step is to palpitate for the tenderness, sensation, the masses, lesion, crepation, and the internal expansion. Start palpitating. Stand straight. So the patient does not have any abnormalities. There is no sign of lesions, masses, or sensation tenderness. Next step is to percuss for the tone at apex above from the clavicle and to the intercostal spaces. Next step is to osculate for the anterior breathing sounds, the adventitious sounds, and the voice sounds. Okay. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. that the patient has a normal finding. Last step is assessing the mobility and the turgor. It will be returned the original shape. Okay. There is no sign of abnormality. The skin back to the original shape. Now that we already done assessing our patient, we need to remove the gloves and do a hand hygiene. Hand hygiene first before you remove the gloves. And need to remove it. Then you need to hand hygiene again. Last step to this assessment is to document and report the assessment data.